Hello, everyone. My name is Veridiana Hernandez, and I will focus on private practice. In this presentation, I will talk about why private practice, education requirements, years of experience, salary, employment opportunities, and why it interests me. Why private practice? With private practice, you basically are a consultant dietitian, which you can be contracted by companies and sports teams. You have the ability to see the client more often than in an acute setting, and thus have more time to spend with them and educate them. Also, in private practice, most of the time clients come to you, meaning they want to make a change, unlike in hospitals when it seems like they don't always have a choice. The education requirements are the same as it would be for a regular dietitian. You have to complete a bachelor's degree from an ASCEND accredited program. However, in 2024, a graduate degree will be required as well to be eligible to take the exam. You also have to complete a supervised practice dietetic internship or individual supervised practice pathway, pass a commission on dietetic registration exam, gain licensure in your state of practice if applicable, and maintain continuing education. You don't necessarily need years of experience to open up your own practice. You basically can open up your own practice straight out of school, but it is recommended to be in the field for a few years. Before one can educate clients, they need to gain experience and a solid foundation. Both of these are key. In May 2018, the median annual wages for dietitians and nutritionists in the top industries in which they worked was 6,370 per year, which is about 2902 per hour. With private practice, it can range from 55,558 to 70,689. However, it is important to know that at first you will be making little money, if any at all. Thus, once you do open up your own private practice company, don't quit your full time day job just yet. The job outlook for RDs in general has a 15% growth from 2016 to 2026. As already stated, you are basically a consultant dietitian with private practice. As such, you have the opportunities to market yourself and your knowledge and expertise to everyone out there. Opportunities for consulting include wellness programs, sports teams, and supermarkets. Even if you are not 100% ready to be on your own, you can gain experience by joining a private practice team, or even launch your private practice without having an office yet per se, and take side jobs to gain a market and experience. Now, why does this interest me? This interests me because it allows for more flexibility. Also, I've always wanted to be my own boss, and it allows for more education and time spent with the client. And personally, I want to be a CDE, which is a certified diabetes educator. I want to be able to educate patients or clients on how to manage their diabetes. And you don't really get to do that very well in an acute setting like hospitals, but if a client comes to you and asks for your advice, then I would be able to help them with their management of their disease. And overall, I just want to aid in lifestyle change. Private practice requires time and patience, and it is good to get a good solid foundation and experience first. However, the low is pay at first, but in the end can be rewarding. Private practice is not for everyone, and one should think very carefully when deciding whether they should be opening up their own private practice. These are my references. Thank you for your time.